Ladies and gentlemen, hello and welcome to this public event organized at the LSE by the LSE Research Unit on Southeast Europe. My name is Vassilis Monastiriotis. I will be chairing this public event. I'm director of the LSE Research on Southeast Europe, and this is our first virtual public event since the coronavirus outbreak. And indeed, our event is exactly on this topic, with a special focus on the Western Balkans. So our topic concerns the implications of the COVID-19 pandemic in the Western Balkans, the economic, social, and democracy political issues that have arisen from the pandemic, and the challenges that lie ahead. The panel will explore how the countries of the region have been tackling the crisis and how they have responded to the challenges in terms of the internal policies, but also more widely the relations with other countries, particularly the European Union. To discuss these issues today, we have three very distinguished speakers with expertise, a lot of expertise in the region, and I will take a bit of time to introduce each of them just now. So our first speaker will be Mario Holzner. Mario is Executive Director at the Vienna Institute for International Economics. He is also coordinating economic policy development and communication there with a focus on European economic policy. He has worked on issues of infrastructure investment in Greater Europe, also involved in the proposal about the European Silk Road. Mario Holzner is also a lecturer in applied econometrics at the University of Vienna in the Department of Economics, and he's done extensive work on the Balkans and the broader Eastern European region through the Vienna Institute. He also holds a PhD in economics at the Vienna University of Economics and Business. Our second speaker will be Arjan Gjonça. Arjan is Associate Professor of Demography here at LSE at the Department of International Development, and he holds a PhD in Demography also from LSE. He has worked in the University of Tirana in Faculty of Economics, and also has been visiting or affiliated with the Max Planck Institute for Demographic Research, the University of Southampton, the University of Bocconi, and other places. His research focuses on health and mortality in developing countries, but he has a particular specialization on the demography of the Balkans, for which he's done work both on health, but also more widely on education and other issues. In particular, with education, he has recently been acted as chair of the Commission for the Reform of Higher Education in Albania in 2013-2015, and he's done work with a number of international organizations, including the World Bank, the UNDP, and others. Our third speaker is Sanja Vico, who is a research officer at the European Institute at the London School of Economics, and she is also an associate with LSE, the Research Unit on Southeast Europe. She holds an ERC, the European Research Council funded postdoctoral research position in political science at the LSE, and she works on a project on justice interactions and peace building. With reference to the Balkans. She has a PhD from the University of London in Goldsmiths, and she has studied previously also in LSE. Previously, she has also been postdoctoral fellow at the Center for Studies of Global Media and Democracy at Goldsmiths, and she has been working as a research consultant and analyst on various projects relating to the Balkans. Before we go to our topic, I have to make some organizational announcements. It is now just 4 minutes past 4 o'clock in the afternoon in London. I know we have a quite international audience, so you will be some of you in different time zones. We aim to finish at 5:30 p.m. British Summer Time, London time, so in 90 minutes from now. If you want to tweet on the event, the hashtag that we use is hashtag LSE COVID-19, one word, LSE COVID-19. And the event, it's an online event. This is being recorded and hopefully will be made available as a podcast, subject to no technical difficulties. We will have at the second part of the seminar a Q&A session, so you will be able to post your questions to the Q&A function of Zoom, and then I will put your questions to the panelists who will respond. So you can submit the questions either if you're listening to us on Facebook, directly on Facebook, or from Zoom using the Q&A function. So as I said, our topic today is the implications of the handling of the coronavirus crisis in the Balkans, but also the implications in terms of politics, economics, and social policy, if you want, of society. I'll pass now the floor to our first speaker, Mario Holzner, who's going to talk on the economic side of this. Mario, the floor is yours.
Vassilis, thanks a lot. Thank you for the invitation. And let me share with you my presentation. Which starts here and is based on work that was done by our country experts and particularly the coordinator of our country monitoring team and Deputy Director Richard Griefson. And I would like to start with a general view that we have about economic development in 2020 for the wider region, Central, Eastern and Southeastern Europe. We are covering 23 countries there. And overall, on average, of these 23 countries, we expect for 2020 a recession that is the worst since basically the transitional recession in the early 1990s, when it was really on average something like 11% drop in real GDP, while in the global financial crisis we had something like 5% drop, and for 2020 we expect something like 6%. Although obviously it's still early to really know what it will be, but that's, let's say, our baseline scenario. Obviously, country by country, things look to a certain extent different. There is a certain range depending on a number of factors, which I will mention in a minute. However, one can say that we expect also quite some robust recovery in 2021 following this dramatic drop. It is interesting to note in this respect that in the region, the death rate has been much lower than in Western Europe. Actually, difficult to compare. It's even less than, let's say, Germany, Austria. And there are different reasons for that. One is probably that the Central East and Southeast European countries imposed much stronger restrictions at a much lower level of confirmed cases early on. So this is like a snapshot from March 15th. Number of confirmed cases on the horizontal axis, the so-called stringency index that measures how strong the restrictions were on the vertical axis. And basically, most of the wider region had introduced a very strong restrictions with hardly any cases. And at least until now, the easing of the lockdown measures have been much more cautious in the Western Balkans than in the rest of Europe. The Western Balkans average is the darker dotted line here. Most recently, these days, basically, we hear from, for instance, Serbia, Macedonia, somewhat different news, but this is at least what happened so far. Coming to the issue of countries being exposed to a different extent, we believe that there are two major factors that will have strong impact on growth outcome. That is, on the one hand, trade exposure. Here we have external trade as a percent of GDP on the horizontal axis, and on the other hand, tourism. And we have here travel and tourism revenues on in the most broadest definition in percent of GDP on the vertical axis. And here we see that those countries that are in the red circle are the most exposed, for instance, Montenegro. And we saw also in one of the figures before that we expect in Montenegro quite a strong drop, much stronger than, for instance, in I don't know, countries like Bosnia, for instance, and not to speak about Kosovo. There are obviously a number of other issues. Also, reliance on capital inflows is important. There is quite some exposure there, particularly with regard to remittances by migrant workers, basically from Western Europe. So these are important inflows in for instance, Kosovo, Albania, but also FDI inflows. So we see here average over the last 5 available years. This will certainly look very different this year. And also to some extent in some countries, hot money inflows. But there are also some areas of potential resilience for the Western Balkans. There is, as has been said, a generally lower spread of the virus than most of the rest of Europe, although maybe we see most recently a certain change in this, but so far this is the case. Also, generally speaking, again, most Western Balkan economies are much less integrated into the global value chains, and particularly the automotive sector, which will have a problem. There has been also quite some quick and significant international support. So lessons from 2008 were learned. Also, euro area monetary policy spillovers and also support from the ECB has been quite good. And there are maybe even some positive risks that there might be a quicker than expected bounce back, for instance, for tourism. What will happen in the wider region in the next decade? Difficult to say, but it's fair to assume that quite a few things will change, others will remain the same. There might be some opportunity from nearshoring, particularly companies from Germany, Italy, might think twice whether they want to have FDI in, let's say, Southeast Asia. So some FDI might be in the future reverted to maybe the Western Balkans, but also other parts of Central and Eastern Europe. Services outsourcing, digitalization. There are pockets of modernization already in the Western Balkans where the digital economy plays already quite some role. It might be that there will be in the future higher and maybe more progressive taxes, a bigger state in general, a bigger role for the state in general in economic life. These are at least the lessons we learned from, for instance, the period right after the Spanish flu, after the First World War. Also, after a certain pause, we will probably see again labor shortages and issues of how to deal with that, automation, that will return again. We have a very quickly aging and ultimately in some cases even shrinking population in the wider region. And probably China's economic role in the region will remain important. So there are a few things which probably will not change that much. To conclude, to sum up, many countries from the wider region will face the worst recession since the transitional recession in the early 1990s. There are obviously major uncertainties connected to these forecasts. There's been less spread of the virus in the Western Balkans and Central and Eastern Europe. They locked down early and were more cautious, at least until most recently, about easing the restrictions. There are major vulnerabilities in the Western Balkans, particularly tourism, certain capital inflows, but there are also some factors of resilience, not being that much connected into the global value chains, at least for some countries in the region. And in the longer term, as I said, a lot of things are going to change, but there are some opportunities for the region as well. So thank you very much for your attention.
Thank you, Mario. This was very, very well timed. So I have asked the speakers to stay with 10 minutes presentation. So that was exactly 10 minutes. Thanks very much for this. It is interesting that you mentioned, and I'm sure we can pick it up in the discussion afterwards, that you mentioned the low level of integration in global value chains as operating as an advantage. And it's funny to see how some of the things that we complain about in terms of how the economies develop and how much integrated they are. But it turns out that sometimes when bad things come from globalization and the global integration, that some controlled integration may work in a positive way. We will leave aside a bit the economics issues and go a bit further on the social issues, but also the health dimension of the pandemic. Arjan, over to you.
Thank you, Vassilis, and thank you, Lisi, for organizing this webinar, very important for the region and the whole world. And I will be talking, as Vassilis said, about some of the main social aspects of pandemic. And as you can see, I'll be focusing on the social implementation. Some of the main things that I'll be talking today is that briefly I'll talk a bit about the characteristics of COVID-19 pandemic in the Western Balkans. I think Mario kindly introduced them, a couple of points there, and I will move them to the policy response to date, because that's where the public policy I would like to see focuses, because that's important for the future. But my main focus will be the social implications in the Western Balkans. There are a lot, but I'll focus only a number of them, time allowing, and a bit on the future policy implications for the pandemic. I would say there are three main characteristics of the pandemic in the Western Balkans. First, the very low number of deaths in the initial stages. I think some of the lowest death rates in Europe. It was not by chance. It was because a very fast intervention, which I'll address a bit later, by the government. The epidemic we say that didn't reach a peak. Rather, the countries flattened down the curve, apart from probably Serbia, but most of them did flatten the curve down. But we see a recent resurgence since the early mid-June, and in some countries this resurgence is even higher than at the beginning. If you look at countries such as Northern Macedonia or Albania or Bosnia, we see that the number of new cases has started to increase, but also the number of deaths in certain days has started to increase. Because this population of these countries are small and the number of deaths take time, with a new resurgence of the new cases, this will probably take a bit of time. Now, this is not good news, because it shows that the moment that these societies were opened from social isolation, we saw a resurgence. These are not the only societies. We've seen that in Germany. We've seen that in some other Western societies or East European societies as well. If you look at the policy response, as Mario said, one of the main policies or intervention that these governments in the Western Balkans did is a very quick intervention. They went into immediate lockdown when the initial cases were up. I'll explain a bit why they did that. Not that they did have much of a choice, but I mean, in some countries such as Albania, the country locked down immediately after the first case was diagnosed, but it was the case in most of the Western Balkans. The second important point to mention, it was a compliance of the population during the lockdown. So what we saw that most of the population sort of trusted the government and went into a lockdown. So, and in that respect, we saw what we call the flattened of the first peak of the pandemic. So we didn't see those small death rates that Mario mentioned. The last point is the policy of easing the lockdown. As it was mentioned, this policy by the stringency index developed by Oxford is considered as cautious. Now, we've got to have in mind two important things when these societies come out of isolation. One is the government policy, the fact that the government is easing some of the lockdown and is doing it slowly, cautiously, but it's also important to see the population compliance to it. So two important aspects. One is, do we have to follow a strict test and trace. Do these countries have the capacities? So far, the epidemic shows that that's not working properly. It is working sometimes, but not properly. And the second, the population compliance is not as it was during the main lockdown. So we see a different population behavior towards the regulation. Now, the issue here is, will the population comply? We have some not good examples from the Balkans, and one that we take from public health is the campaign against smoking. Although that these societies do have very strong, very strict legislation on smoking in public places, that's still not stopped. Even in countries when we see some control of that, such as Albania, that's happened because of extremely strong fines that exist. So we will see in the coming weeks and months about the compliance of the population. Did these countries have any choice in terms of the intervention, the lockdown policy? I don't think so. It's because the countries that didn't do an immediate lockdown, such as Germany, they did have what we call surge capacities in public health. So they did have material and human resources to cope with that. And here I talk that some of the budgets of these countries in terms of healthcare expenditure are very small compared to their also level of GDP. And we know that, I mean, if you see this graph that puts the GDP per capita as well as healthcare expenditure per capita, we see that most of these countries are very close to each other at the bottom side of the graph. And here is where most of the Western societies are. But we also know that one of the reasons, or one of the issues in terms of public health response, was the capacity of intensive care units. And an approximate indicator that you could get the data on was the acute care beds per 100,000 people in the Western Balkans. And as you can see, most of these countries underperform compared to European Union average here. So all these countries, I don't believe, and a lot of scholars do not believe, that had the public health capacities to cope with it. So the lockdown, the immediate lockdown, was possibly the best policy to follow, and it gave some results. As I said, when I wanted to focus to some of the key social implication, I'll start where, in a way, Mario left. He mentioned remittances, and I'll talk a bit about remittances, but not from the capital flows in these societies, rather than the implication aspect of that for some particular vulnerable groups. I'll talk about the strains in public health, which will be considerable in the coming years, not just as a result of only COVID-19 as a pandemic. And I'll talk about social cohesion versus social isolation, something which is very particular for these societies in the Balkans and Mediterranean. I'll briefly start the freedom and civil rights, but it's much more an entry point for the next colleague to talk in more details on that. We know that a large proportion of the household budget, but also of GDP in these societies in the Balkans, come from remittances, as high as 17 and 18% in some particular years, to Kosovo being with the highest personal remittances as percent of GDP per capita. And then you have Bosnia, Albania, Montenegro, and most of this country. And if you compare this with the level of Eastern Europe and the Baltics, you can see that these countries do receive a very large proportion of a very large amount of transfers as a result of remittances. And the problem with remittances is that we have a lot of evidence in terms of research. Where do these remittances go? These remittances go to a very particular group of the population, the elderly. Because as we know, if you look all this population structure of these countries, the young and the active population, the labor force has emigrated. And that has created an old age population, an elderly population, which are dependent in a majority to remittances. And if these remittances go down, there'll be two effects to that. One will be a direct financial burden for them. So it might increase the poverty. In the Western Balkans, the poverty used to have a young face. Now in the next decade, it probably will have an old face, with the elderly probably being most affected because remittances will go down by default. And the second, it will have an indirect effect as a result of healthcare and social care. Social care in particular, because if you don't have any siblings to look after the elderly, usually this will be in the informal sector with somebody paying, and if they will not have the financial resources, that would be an issue. The second point which I said that I wanted to address was the public health financing. We know that these countries, as I mentioned, do have very small budget and very small expenditure in terms of healthcare compared to the rest of Europe. And as such, that will put some restraint in the budget, in the health budget for the coming years. The restraint will be not just, as Mario said, as a result of economic recession, which these societies will go through, and then the governments will be faced with the burden of where they'll put the money, but there will also be, because of the increased burden of COVID-19 pandemic, a large amount of this budget have gone for the provisions of the pandemic, which means moving the money around from the other sectors of public health care, such as tertiary care or even primary health care. What this means is that this will increase the burden of other diseases in the coming years. And this is universal. We'll see that also in Western societies. So it will increase the burden of cancers, the burden of cardiovascular diseases, but in particular, mental health disorder. I mentioned that I briefly will look at social cohesion. Social cohesion in the Western Balkans and in the Mediterranean part of the Western Balkans is very high. This means that the social networking, the higher social support that exists in this society, the trust in the communities and in each other. Why do we study that? Because they are extremely good mechanism for coping with stress. And under this pandemic, stress is an important element which will probably drive a large number of mental health disorders. But in these societies, social cohesion is a way of life. And if you change the way of life, you'll change a lot about the psychological aspect of living and livelihood in these societies. In the main question here is social isolation distancing going to change social cohesion? Well, let's put it this way. If there will be no vaccine for a long time, I believe the social cohesion will strongly be affected in the Western Balkans. It will mostly affect the health of the most vulnerable people, in particular the people that are alone. And that will increase by default the mental health disorders and the loneliness. My last point on the social implications has got to do with freedom. I mean, people like myself that have come from that area, we do pay a lot of emphasis on the importance of freedom, on the importance to choose what we want to do. And we know that lockdown and the social isolation, even in the coming months, will affect our possibility or ability to move, will be restrictions to meetings with the relatives and friends, restriction in traveling. So there will be restrictions. The freedom to choose will be restricted and is restricted. And this will go on for a while in the Western, even with very mild measurements of social isolation. The point in here to ask is that, will that be used by some of the governments of the Western Balkan societies in a way that they'll misuse in restricting freedom overall in the societies? I don't think I have an answer to that, but it will most likely, and probably Sanja will talk more about that and the political aspect of this. But that's another issue to be addressed. So finally, my last slide is about some of the implications. I mean, at present, we need to have more dissemination of information to change the social behavior, because it's moved somehow from the government policy to human behavior, to people's response to the policy. And in here, we have an issue. There need to be more dissemination rather, and the population to get more involved with it, because when the resurgence tells us that they are not applying the social isolation measurements. We also need to shield the most vulnerable, because if the epidemic increases and the capacities cannot cope, as we know in some of the Western societies, then you need to shield, particularly the most vulnerable and the elderly. And those policies have to happen now. We're not talking about the next decade. We need more investment in public health in the coming years. I mean, if there is anything that I believe will change, not just in the Western Balkans, but all around the world, is the way we prepare for the public health in the next coming years. There will be more attention to mental health disorders in the coming years. They already compile more than 30% of burden of disease in our societies. But to keep that burden of disease at those numbers and not to allow that to develop in more chronic and more deaths, we need more attention towards that. More attention to the most vulnerable groups, not just now, but also for the future. And that's very important. We need not just shield the elderly now. And let's not forget one, these societies are aging very fast. The population over 60 is more than 20%. And in the next year, our projections tell us that it will be close to 30% in Serbia and Croatia, even in Albania and some other countries, it will be that high. So we need to consider that. Attention should be given to civil rights and freedoms. Democracies of this area are not perfect, and there should be a balanced approach between economic policies and investment in social agenda. We don't need to go into what we went in the UK in 10 years of austerity, because we need to get out of this crisis. And I'll close it now because I think I have overdone with a few minutes.
Thank you very much, Arjan. Very many interesting points that we can follow up. I think living in the UK, of course, when you mentioned that people in the region value a lot of individual freedoms, I think you also get that here in the UK a lot about sort of, civil liberties and individual freedom, and how that then contradicts or restricts the policy responses that we can have. But talking about people and behavior, let's look at the wider picture and the politics dimension of that. Passing the floor to Sanja.
Thank you so much, Vassilis, and thank you everyone for joining us today. I'll just briefly share my screen. So I will be speaking. I'll address several issues. One would be nation branding during coronavirus pandemic, relations with the EU, migration, and public opinion. My focus will be on Serbia, mainly because my research has been mainly centered on this country, but I hope that there might be some conclusions that can be applicable to other countries. So I'm sure that many of you are familiar with these pictures, but I shall briefly say that in early March, when the EU's immediate response to the outbreak of the virus was to put a ban on exports of medical equipment, which infuriated the president of Serbia, who famously called the European solidarity a fairy tale, and then he sought help from China, and China responded positively to his plea. Shortly afterwards, EU abandoned this ban and provided an aid to Serbia worth 93 million euros. However, China's aid received much more attention. And these pictures are both ordinary and extraordinary. They're ordinary in a way that this rhetoric has been present in tabloids like Informer and similar TV news channels, so there isn't much new about that. But what is extraordinary and new is that now this rhetoric is seen on billboards, and as such, it arguably can reach much greater audience than it otherwise would. So it's basically visible to people who don't necessarily read Informer. It also was much more decisively endorsed by the officials. What is extraordinary as well, as these pictures are showing, is that this was picked up by international media. So it made stories in the Financial Times and The Guardian. And the first question then comes up is, who is the audience of these messages? Who are the people who this message was meant for? The answer is both domestic and international audience. It's international. It is both China and the EU. Serbia is the fourth country in Europe of China's investments, and this was an opportunity to strengthen that bond, especially given that the EU enlargement has become increasingly uncertain in the past years. When it comes to the EU as an audience of these messages, actually we can see that these headlines are flattering in a sense that the Balkans and Serbia are presented as a very attractive geopolitical place. It says the fight for influence in the Balkans, or how Russia, China, and EU read to win Serbia's. I can't see the title now because it's covering, but generally these are in this sense, it can be argued that this aim was effective. There are other examples of how the aid became a means of nation branding and diplomacy, and we can see on the 28th of March, Albania sent aid to Italy. 30 medical staff was sent to help. Italy at the time was the worst hit country by the pandemic in Europe. And then on the 20th April, again, they sent their aid. And we can see here Italian Minister of Foreign Affairs tweeting to thank Albanian government and people for the second big testimony of friendship. 5 days later, Serbia also sent their aid to Italy with a message written this parcel: Vinciamo insieme, coraggio Italia, la Serbia è con voi. We will win together, courage Italy, Serbia is with you. But these media representations, as I said at the beginning, also have domestic audience. And here we can see the perks of perception. We can see that majority of people think that China is the main donor, whereas actually it's the EU by far. However, still, most of the population in the Western Balkans remain very supportive of EU integration. This has been fluctuating over time, but the overall support has remained constant. And at this point, I shall say that also 90% of immigration from Serbia is to Europe, out of which 2/3 is moved to Western Europe. And this links us to my next point, which is migration. There was a striking trend during coronavirus pandemic of repatriation across Europe. And here we see actually that Western Balkans have the highest rates of immigration among Europe. And it has been recognized as one of the key problems for the past few years. And here we can see that data by OECD shows that 49,000 people leave Serbia every year. About 33,000 return. However, those who leave are usually younger people, whereas those who return are mainly older people with families. These are some projections of demographics. Of course, it's not all due to immigration. It's also because of lower birth rate compared to death rates. We saw also that around 400,000 people was said to have returned to Serbia because of the pandemic. However, we still don't know the structure of these people who return, whether these are people who lost their jobs, or these are these younger people who, for instance, wanted to spend quarantine with their families rather than being on their own in host countries. And again, among those who did lose jobs, whether they intend to stay, or they consider looking for jobs elsewhere. So this can be an opportunity to attract these people to stay, because the more people leave, the less attractive it is for people to stay. So this prompts us to ask what are the motives of those who consider leaving. The Westminster Democratic Foundation found that young people usually mention economic reasons and unemployment. My study, my qualitative study of Serbian Londoners showed a much more complex picture, because although professional motives played prominently, they were intertwined with other reasons, such as identity and values. And in that sense, the emphasis on Europeanness was quite prominent, especially among participants who had lived on other continents. And this, by identifying as European, they attempt to position a Balkan symbolically within Europe, to claim, whereas Europe is not just seen in territorial terms, but also as a symbolic space that embodies certain values that they identify with. And here we see that this participant's parents wanted to return her to Europe to connect with her roots. In another quote, we can see also this tension of Balkan being part of the Europe geographically, but not fully European symbolically. He says it is Europe, but it's very different from Western Europe. Again, emphasis on Europeanness is often associated, as I said, with certain values and with openness, as this quote shows, such as openness to difference. But it is also often associated with freedoms or certain democratic standards, as this quote shows. This participant says, I think the EU is a good thing. I like the idea of free movement of labor. I'm not concerned about the UK as much as for Europe. I'm afraid that the UK hasn't set a good standard that other countries might follow. The EU is actually the only solution for Serbia if the EU falls apart. Serbia might go backwards, kind of echoing this transformative power of Europe. This was mentioned he was reflecting, or he was sharing her views of Brexit. And there were participants who did vote for Brexit and who are EU skeptics, but what they mentioned was kind of preservation of British tradition. And when you think what is British tradition, the longest British tradition is actually the rule of law, which was founded with even Magna Carta Libertatum in 1215. So for all of these participants, in a way, what matters are professional opportunities, but also certain values, mainly democratic values. And also we can see this identity-driven return to Europe. So my concluding remarks in this sense would be, as a way of forward, economic recovery is important, as we saw from Mario's presentations, Arjan's presentation, but so is democracy for these people. And on the other hand, the EU should also reposition itself as a key international player by promoting solidarity, by integrating Western Balkans more in its processes, but also building better channels of communication. We saw that shaping public opinion is really important, and it's important that their messages can reach those who are not necessarily interested in politics or well-informed, but who are overall pro-EU integration. And that's it for me. Thank you.
Excellent. Thank you, Sanja. And I'm very happy that we kept in time. I didn't have to stop anybody. So we have quite a number of questions already, and I would like to pass them on to you. But to give a bit of time also to other people to collect their thoughts, if you want, and prepare the questions. I would like to ask a summary question that each of you can answer. In the crisis, in the Eurozone crisis, in the global financial crisis, one thing that emerged from the region was that there was very good, or at least to some degree, there was substantially good support by let's say, the international community, European institutions, and also other organizations, the IMF and others, the Vienna Initiative and so forth, to stabilize the banking system and so forth, helped the region a lot. But actually, we had a significant experience of what I would call good policies in the region. So during at least the second phase of the crisis, the Eurozone crisis, central banks did the right thing, although, of course, the region is affected a lot by domestic politics and, you know, the various dimensions of it, including the ethnic identity and so forth dimension. But policies at the macro level seem to be, on the whole, good, which created confidence in the international markets, and then, you know, in some way or another, provide more resilience to the economies in the Balkans. Would you have a similarly positive assessment for the policies that have been applied so far? I mean, you all touched upon issues of policy. Sanja was talking more about, if you want, the diplomacy of treating the coronavirus, but of course, Mario, on the economics, and Arjan also on the health dimension. How would you evaluate the policy? Would you say, also comparing to maybe the countries where you're based, or more generally the responses in Europe, thinking about what happened in Italy, in Lombardy, but also other complaints also here in the UK? How confident can we be that, you know, all the negative things we say about the region, about corruption and clientelism and low governance capacities, can we have a positive message of good governance and good policy responses? Who would like to start with a positive note?
I don't know, should I say something first? Or well, I mean, because you asked whether there is a chance also for a financial crisis, maybe, or how would that be tackled also? I mean, it's like it used to be also during the last crisis. It's in a way an advantage that the region does not possess own banks. The whole banking system is owned basically by foreign banks, Austrian banks, Italian banks, and maybe one or two Belgian and French banks. And in that sense, it has direct access to ECB money, and the ECB is flooding this whole continent with money, which is a good thing for the financial system. And the ECB has probably learned from the problems that happened last time in the last crisis, when they too early started to increase the interest rates and stopped monetary easing. So in that sense, it's maybe not so important what the economic policy response in the region is, but rather what the policy of the ECB and the fiscal stance of the euro area member states, particularly Germany, and in that respect also Italy, will be. And here we see a more positive development than in the last crisis. I think there has been a change in the overall mindset, particularly in the German finance ministry, which is very positive. Apart from that, I mean, a lot of the policy response so far in the region itself was not that bad, but it was a lot of announcements where we do not know exactly how much that really is in real terms.
All right, thank you. It's a bit difficult to predict because there are two different types of crisis. That's why we called it a pandemic, because everybody has been affected, the economy of every country, and more the countries, the far richer countries, the high income countries are affected more. I mean, I agree with Mario that more than their own internal financial or economic policies will be how EU and the European Central Bank will react to, and EBRD will react to support these economies. But there is a big question, and the big question has to do with what will happen with the Western economies. Will there be a central focus on self-reliance and more on then internal production of their own issues, rather than the idea of globalization and helping the finance all around with more internationalization? Or will that go in the opposite, and that will depend on, probably, as Mario said, I mean, the way EU goes about it, and also certain policies. But the initial signs in UK are such that we will be seeing more internally rather than externally. If you think about the fact that we didn't have enough tests, but now we are creating a public company in pharmaceutical industry to create our own tests, so we are more prepared as a public service, so we're more self-reliant on our own production. I don't think that would be a good trend for the future for low and middle income countries. As to the health, I don't think it will be much different. I hope that health and other social aspects will not suffer like the last financial crisis that were left behind, in particular in the country that the two of us reside in, UK. I hope that the economic, I mean, one of the important things to bear in mind is that the economic recovery should take social agenda into account, different from previous crises.
Very good. Sanja?
So we have seen positive developments when it comes, for instance, with the relationship with the EU in Western Balkans. More recently, we have seen positive exchanges between Serbia and EU representatives, and also in that sense is important the readiness for the Belgrade and Pristina to negotiate. But on the other hand, Montenegro, the EU opened the last chapter of negotiations with Montenegro, which was also positive. Before that, we've seen in March that Albania and North Macedonia received green light to start accession negotiations. So there are positive developments in this relationship and international relationships of the Western Balkans. So in that sense, they are, even though we have seen the negative effects of the crisis, of the health crisis, there were also these positive, I would say, developments. But of course, opening the chapter, for instance, doesn't mean that other chapters that were opened are now closed. So there is still a lot of work to be done here, but I think this was a positive signal from the EU that they still have interest in accession and interest in the Western Balkans. Also in terms of the aid they sent and plans for future help in terms of economic recovery.
Thank you, Sanja. So I'm trying to collect some questions from the audience. I think I would like to start on the topic of the welfare state, and in a way, each of you touched upon issues on the welfare state. So we have Arjan Lorenzo, a former student of yours, who sends greetings, asking what, if you can elaborate on exactly on that, on the effect of the COVID on the welfare state, welfare systems in the Balkans. Will the crisis galvanize an expansion on social protection, or will the cost incurred bring a period of austerity? And I think there's other questions on the welfare state. As I'm trying to locate the specific question, it was addressed to Mario. Mario, you said that one of the implications that you see prospectively is the idea that we'll have a stronger state, a stronger role of the state in the economy, partly due to increased or the need for increased taxation. So actually, Vano Dobrotic from the University of Oxford, who was also with us in an event we had in Belgrade in the life before coronavirus. So the question is, how do you see that this may affect this, the stronger role for the state may affect spending on the welfare state in the region, and especially programs that are not provided on social insurance principles, and so the ones that are basically addressing the most vulnerable population. I can also link to another question on welfare state dimension, which is about, because we talked a bit about the remittances and the elderly, but how or to any degree, is there any effect that we could say similarly for children, or the gender balance for females, and so forth? And also whether, perhaps address a question from Vesna, our colleague, to Sanja, our colleague Vesna at LSE, of whether the people who you can access, the Balkan migrants in the UK, whether they have a different experience of policies and different attitudes to the EU, whether enough is being done in relation to welfare state policies for people in the region to feel that there's positive progress, and then to favor also deeper integration. I mean, confidence in domestic politics, but also integration with the EU. So a range of topics, but they all touch upon aspects of welfare state. Shall I start this time from Arjan, the response, and then we'll go to Sanja and then Mario?
Well, thank you. I think that's a good question. It's an important one when it comes to the social agenda. I mean, will the welfare state be influenced, and how it will be influenced? Well, it will be influenced. In any economy that shrinks by 5 to 10%, the welfare state will be influenced. The point is that what will be the policies to improve and not to pass the social consequences to the peoples of those, to the populations of those countries. And we do have a couple of good experiences in the past. We don't have just the bad experience of the last financial crisis in UK with the austerity that all the health and education and the welfare state suffered. We do have the experience of the Keynesianism approach to the post-depression with huge public investment, which probably will be an approach also followed by some of these governments. And that's where the role of banks such as EBRD and other international funding bodies will help. The second point to make is that we had the Atlas government after the Second World War, which was very welfare state directed at some of the top policies that we have today, from the creation of National Health Service to a lot of other policies on housing, etc., are policies that do help through employment, but easing also the social consequences. What positiveness to take out of this in terms of welfare state policy? I think I'll leave it to this for the others to answer, but I think you had a sub-question. Was it for me on a children and gender perspective? If I may answer that, yes. I mean, most of the demographics and social consequences in the Balkans do have a gender flavor, and there will be. I just finished some work on that, which is going to come to be published in very short, that you see this gender disbalance in households, in other parts of the societies. The close down has been associated with violence. We need to wait for research to come out of that. But in terms of the elderly, I don't see any we don't have evidence so far that there is a discrimination in terms of poverty at the old age. We do have children. In some societies, we do have males favored in terms of nutrition and wealth and care in the households compared to females. And I'll close it here.
Sanja?
My response to Vesna, was my study first, it was qualitative. So in that sense, I can't speak about percentages. Also, what I found out was that professional reasons do play prominently. But what qualitative methods afford us is actually to dig deeper into narratives and understand, the actual substance of their motives. Because when people start talking more about it, then you understand that there is actually a mix of motives. And there are other studies on migration, that also show this. Quantitative studies, because of their, method approach, inevitably slightly sometimes simplifying what we can see. So in this sense, professional motives are key thing that my participants would mention, but then when we start talking, you understand that it's also about certain values, about how society is structured and how society function. Then they mention certain freedoms. And then you understand that these motives are actually very interrelated. It can well be that people who consider leaving don't have exactly the same motives as those who have already left and then start reflecting what their motives were. But this is what I could find through my research. On the other hand, I should say that also the migration to the UK was in a way peculiar because they are overall roughly defined middle class. So in that sense, that can be also why their motivations are as such, unlike some other countries, and this is historically been like that, unlike some other countries such as Germany or Austria, where you had more so-called economic migrants, but I'm although very critical of these terms, because we can see that people, these young, well-educated people also migrate for economic reasons. I hope I answered your question, but please feel free to add some question if I missed to address something.
Thank you, Sanja. Mario, would you?
Yeah, there was also a question I saw on the exactly this migration issue and whether there will be another brain drain.
Yes,
coming.
I was planning to bring in the migration issue as.
I think that is related somehow. I mean, certainly what we will see in the next year or two is another wave of people trying to get out of the region. As obviously the usual push and pull factors for migration, a lot of them are unemployment, wage differentials, or a prospect of a very slow convergence, and that's all there even more than maybe a year ago. So it's fair to assume that there will be another massive wave of migration out of the region, and that will have the effects we have been touching upon already. And also, I think Arjan showed the projections from the United Nations on population development. If you look at the population in working age, then that is even more worrying. And so with the projections as they were before, you can just imagine what they will be now in the wake of the crisis. So, and then something will happen very likely. What happened already before, for instance, in the Baltics, in Central Europe, where these processes were more severe already for quite a while, and were basically, like in the Czech Republic, we reached almost, or basically reached full employment a few years ago. And in many of these countries, we saw, for instance, that the flat tax system was abandoned, a progressive taxation was included, that pensions were increased, that all kinds of social transfers, but also various other welfare state elements were increased, were stepped up. And I think that is the likely scenario also for the Western Balkans over the medium to longer term, from going now from this crisis a few years forward, and that makes also sense in many other ways. It is also apart from nationalism that we have been consuming quite a lot in the region, it's also a way to keep the population at home, particularly the young ones, give them prospect of a future, at least for their kids, with a better healthcare system, a better schooling, and so on. And in that sense, it's also actually a policy for competitiveness, reducing also the costs and the risks for the individuals, for the employers also who want to invest and who want to plan and see whether there is demand for their products and so on. So I think that will is not an unlikely scenario that could happen in the medium to long run.
Right, thanks. Can I bring Arjan on this question about brain drain? And I would also like to mention a question by our colleague Tena Pellets, who asks, let me find it. She's a LSE affiliate, but also a research fellow at in Oxford, the University of Oxford. And she asked particularly you, Arjan, says, can you tell us what kind of impact did the high levels of immigration from the region, especially of medical staff, have in terms of the Western Balkans government response, and in how the impact on how Western Balkan health systems were coping? Of course, we know that there's this kind of brain drain of medical staff from the region. So if you can relate all that, and of course, then if there's some sort of return policy, that would be, you know, working on the positive side for the region. Arjan, you're muted. So if you can unmute.
Thank you for the questions. Very important and important questions for the region in particular. I've been talking in the last 10 years in the region on different forums that the most important demographic phenomenon that needs focusing and particular policies immigration is not just fertility, because they've been focusing too much on fertility. And most of our research recently shows that the aging of the population in some of these societies come mainly from the middle as a result of shrinking working age population rather than lower long-term levels of fertility. So yes, immigration is extremely important, has been important in the past few years, will be important in the future. I mean, my only difference from what Mario said is that in the next 2 years, I do not see strong migration wave. It might be afterwards, medium term, not short term. The reason being is because the pull factors will not be strong, because the unemployment will be high in the Western society. Plus, the migration from the Balkan has got a family component. You need somebody to go somewhere. And because of the unemployment and because of the financial difficulties, the short-term migration might not be high. However, coming to Tena's question about the medical professional, I believe that there will be specialized emigration. And that's because of the needs in the Western societies will be such. There will be need for medical profession. I mean, the whole university system in Albania has been directed in producing nurses, medical doctors, and medical professionals for the Western societies. I mean, much more than the needs of the country itself. And that's been continuous for the last 10 years. So I believe there will be specialized emigration from these countries. Coming to the general question, I think, from the colleague from social policy at Oxford, how important was the lack of medical profession to the crisis and the way the public health responded. If you read, I mean, there is a contradiction. The popular belief is that these countries seem to have a shortage of human resources. In fact, they produce a lot. They might not have the experience, medical professional there, but they do have the numbers. So the numbers are not that bad. The main problem is the technology and investment in tertiary care and in other aspects of hospitalization rather than human resources. I don't think it was a reason on the way they reacted, but it was a fear. These governments knew that they had very little investment in public health care in terms of readiness. I don't think it was mainly human-driven rather than hospital-driven in terms of intensive care units.
Thank you, Arjan. So I'm trying to organize the questions, and I want to go actually on this point that we raised about the second wave, the possible second wave, and how now, although we had a lot of compliance, perhaps surprisingly a bit for the region, in the first phase of the imposition of the restrictions, now perhaps compliance is withering, and in the danger of a second phase, we may have very big concerns about the effectiveness of policy measures. So if I can locate, the system does not help me hugely, but I want to bring in particular a question from Flora from North Macedonia, student, if I can find the question, yes. Because she says she's an LSE student from North Macedonia, and she addresses this to all speakers, says, although the Western Balkan countries had a good response at the beginning of the crisis, the situation seems to get worse in North Macedonia, Serbia, currently Kosovo, and so on. What are the reasons behind this? And my guess would be party interest and corruption, but I would like to hear your opinions. Let me also link this to a question by Agath Nowak from University of Edinburgh, a student from France, who says that given that cases in North Macedonia are still quite high and rising by roughly 200 a day, do you believe that the ease of lockdown is linked to the upcoming election? So again, the political electoral dimension. I think also the issue of elections and political stability comes from another question that I will read to you just very quickly. Jessica Murray from JP Morgan Research Department. How concerning would a change in political leadership be right now? We have seen stability in the recent Serbian election, but the upcoming Croatian election look more uncertain. Of course, I'm pretty sure we can have uncertainty in the region throughout at short notice. So yes, what happens with compliance and whether people's responses are linked to politics and whether politics are responding to that, especially electoral cycles and so forth. Would like to speak to this set of questions.
I can briefly mention that at the beginning, we could see that people were complying, but also at a certain point, by mid-April or late April, also this kind of support for these policies were subsiding. So it's also a matter of, to what extent certain policies can be effective, whether at what point people will not be complying. Obviously, it depends on measures that the government will introduce, but also in order for these measures to be effective, it needs certain support from the people. So I'm not the best expert to speak about, about health issues. So I think this requires an expert on health and economics, perhaps, to kind of to understand whether this was too soon to lift these measures. But from the point of public opinion, I can say that the public support was subsiding at the point of like late April.
Yeah, I mean, I can come in about the second wave because I think I mentioned it a bit in one of the questions was addressed to me. I don't believe that the second waves in these countries have to do anything with the political scenarios, because then it looks like a too far-fetched situation that happens at all countries at the same time. I think I'll go back to what I said, that the second wave has to do with human behavior and the strictness of the policies of easing down. And I brought the one of the most important public health policies, the smoking, because it has worked in one particular country that most of us thought it was not going to work, Albania. It has worked purely because of very high penalties that exist. So you don't see smoking in public places there. And it hasn't worked out in places I expect it to work, such as Greece, Serbia, Croatia. It hasn't worked fully there. What does it tell us? It tells us about the way the population react to certain policies. I believe the easing of the lockdown should have been accompanied, similar to Italy, with high penalties for breaking certain rules. We have seen that in UK. In UK, it's happened the same as in the Balkans. It's been eased, but not with high penalties. So in that respect, I personally expect the numbers to go up in UK as well, not just in the Western Balkans. So I think the easing should be, it's more to do with, as Sanja said, people's compliance. People need to be more informed. And if they are informed and don't comply, high penalties should be in place.
Right, Mario, would you like to say something, or should I move to?
Well, maybe just a word, because I mean, I think today we are all health experts, a little bit at least, and I mean, I think it will also have to do a lot with how frightened people are. I think that is an important element in all of this, and what are the pictures people will see, and will be presented. And I mean, today you had on Twitter photos from Sanjak, I think, where you had obituaries, a lot of them really, from the old people who died in the last days, you know. And I think that will be important, but difficult to predict how big this wave really is. The experts say that the virus might have changed a little bit into a softer version and so on. You know, it's hard to say.
Can I add something to what Mario said? Because that's really scientific. We know from different pandemics. We know that people in sub-Saharan Africa change behavior regarding HIV/AIDS when death started to live with them around. They started to believe that this was real and was taking place. And we know that in Lombardy, in Italy, people are much more compliant with the regulation because that's where the intensity of this pandemic has been the strongest in Europe.
Yeah. We're almost running out of time. We have just over another 10 minutes. So there's a big number of questions. I want to go to a big set of questions about FDI and the day after and the economy. But let me bring a couple of questions partly related to that from our Facebook audience. So Yasmina Mkonia from Croatia is asking, how can countries in the Western Balkans compete economically in the post-COVID world, assuming the post-COVID world is coming sometime soon, of course. Can they cope with the inevitable deterioration in their fiscal position? What are the main economic policies that the government should implement at least in the medium term? And I guess this question goes mostly to Mario. And another question by a student, Jean-Claude Bimana from Harare in Zimbabwe, and asking with a question with more general interest of how the post-COVID-19 political economic the policies are going to address the current state of digital divide for less developed countries, developing countries. So I think there was a mentioning on that post-COVID still the labor shortages and automation would still be an issue. I would like to put these questions to Mario. There's also a couple of questions on FDI, the role of FDI, partly whether Chinese FDI can come in and support more than European FDI, and I think quite the opposite was the suggestion by Mario, but also some other questions, I think, by a former student, Fail, and by Tena as well about the role of FDI. Mario, if you would like to kind of provide some comments on all these topics.
Mm-hmm. Yeah, thank you. Well, the basic idea was that, and I have to say Chinese FDI is still not very important. It increased quite a bit, but still it's really negligible. China is present with construction projects that are financed by Chinese state banks and operated by Chinese companies. But in terms of FDI, it's really a German FDI, a bit of Italian FDI in the production sector, and in the service banking sector, financial sector, it's maybe Austrian FDI and so on. But if we want to look at very productive investments that the region is longing for, not only since yesterday, but for a long time, and was mostly passed by investors. And then we are talking about car industry, machinery, about core elements of the manufacturing sector. And we know because of the wars, most of this FDI went to Central Europe, and a lot of FDI also went to Asia. And so the idea is now that maybe there will be something like this nearshoring coming, that less FDI will go far away from Germany and Italy, and rather will be invested in closer places, including the Western Balkans. And here, traditional FDI support is obviously a good idea to have. There are also on the regional level with also including the RCC and a number of players trying to organize also a branding of the region as an investment destination, because after all, we should not forget, these are tiny countries. The combined Western Balkan GDP is something like half of the Greek GDP. So we are really not talking about a huge market, maybe Serbia, which is about half of this again. But in the end, these are all more or less something like city-states, like it's the capital and a little bit around it, you know. And so in that sense, a classical FDI policy will make it, but also I think elements of this welfare state, of increased welfare state, will be important to actually keep also the workforce at home. Otherwise, if there is no one left to work, then also investment will not come.
Okay, I would like, thanks Mario, I would like to also add another set of questions to you before moving to the other topics. So we had a few policy people. So Francois Jacob from the UN delegation in Serbia is asking about an opportunity, the crisis as an opportunity for green growth, and also Alessandro Zanotta, also from the EU delegation in Serbia, I think is making a similar point about green growth and whether COVID, as it also we see changes behavior from the consumer side, you know, and also maybe, you know, buy locally and things like that, whether it provides also opportunities for new job creation in the, you know, in green sectors. And we see, for example, in Serbia, the response has been very much in, you know, investing in existing, if you want, energy solutions, energy models, so not the green shift that one would be hopeful about. Mario, would you think there is a reason to think about a future post-COVID which is going to be more green in the Balkans?
Well, difficult to see this from the current perspective, I have to say. It really depends on certain project. Do you find also someone who is a big player maybe in a certain field and makes an investment, and you hope that there will be similar maybe also local offshoots coming in. So one big player can make a big difference. Yeah. But from the current structure, it's very traditional, old style manufacturing that is coming to the region, and I would assume that this is also what we will see in the future. The digitalization thing is maybe something else, and I think Sanja or Arjan mentioned it before. In this crisis, the old people in general have the bigger problems, also economically, while the young people might be in somewhat better position. And we know from particularly the urban areas in the Western Balkans that there are already a number of interesting local businesses in the digital economy, and that also China, but also I don't know, IBM and firms, Microsoft, are having their in a way farming institutions present, looking for the brightest people in that area. And so that is something that certainly is already in the making and might have a future in the region.
Thank you, Mario. I think I will try to close with another set of questions which go a bit on EU relations, but also aspects of freedom and so forth. So mainly addressed to Sanja, but I will go first to Sanja, then leave the floor to Arjan as the last speaker in the Q&A. So I think there were, so let me locate the questions and run them quickly. Thank you for your patience. So Leonard Oldenburg from Goldsmith asks Sanja, when you speak about better communication from the EU to the populations of the Western Balkans, what form do you think that should take? So that's a very specific question on your presentation. And then I have a question on, sorry, just trying to locate. Sorry for the pause here. Yes, so a question both to Sanja and to Arjan. What does the restriction of economic freedom imply for the area, for the region in the post-COVID period? Joining the EU involves such restrictions. So loss of individual freedom and of collective freedom, as we know from the Brexit saga, as well as it involves also changes in all habits, including attitudes towards women. How can the new coronavirus situation and the restrictions be presented, negotiated, and enforced, for instance, in Albania and North Macedonia, how they change attitudes, and how does this link to the restriction of or the sense of individual freedom? And then a question more to Arjan by Diana Barzi. You mentioned that democratic values of people who live abroad in relation to them who live in the country, most in Albania, Kosovo, Serbia, North Macedonia, Montenegro. What kind of role are states, I imagine, in the region we follow related to the economy? Do you think it is time for the region to realize immigration, so to, I think, open up for migration within the region and I suppose integrating, movement of people within the region, also in relation to responding to the crisis. So I think as my last set of questions is that specific question of the EU communication to Sanja, but also wider questions about democratic freedom, both at the institutional level, policies and restrictions, also coming from the EU as well, but also at the individual level and behavioral responses. So Sanja, if you could respond to that, and then Arjan will give the floor to you.
The issues with communication were actually identified very early, even in Simon Hicks' book on political system of the European Union in 2004. At the time, our media landscape was much different, or environment in a sense. He was talking about a lack of a TV station dedicated to EU, but today, as we live in a more digitalized world, that would mean navigating this digital media environment better. And it includes many things. At the moment, what I can see is the presence on Twitter, but Twitter is not representative of the whole population. That's one thing. Around 11% of the Serbian population uses Twitter. The other thing about Twitter is fragmentation, that people who are interested, whether they agree or disagree, are the ones who are going to follow or comment someone on Twitter, whereas the population actually that the EU needs to reach out to are those that are not that much interested in politics. And in the world led by algorithms, that might involve also figuring out how these algorithms work and how they can reach these segments. We could see also that billboards are used as also as a method, but sometimes this method is not effective. There was an example of EU billboards in Wales, in a smaller town, which actually voted to leave. And what they found out, it was because of adverts that they were seeing on Facebook. So there is no really a straightforward and simple answer, just because the digital environment is so complex, but certainly navigating this environment better and using more actually channels and tools would be my answer when it comes to...
I think we have just 1 minute, and I want to pass the floor to Arjan.
Yes, sorry about it.
Thanks, Sanja, and sorry but we had too many questions. Arjan, can you want to take the last minute before we say goodbye?
Okay, thank you. I will briefly say that at the issue of democracy and freedoms and human rights in the region, we don't have full democracies in this region. We are aware of that. The democracies are frail. And one of the things in the EU, Western Balkan relationship shouldn't just be about economics and legal aspect. It should be about values as well. And democratic values should be a normative for these countries to be part of this. And it should be work. We know some of those rights have been abused even during the pandemic. I think Sanja talked about it, but I can carry on and talk it. But these are extremely important. And we know that in crisis, situation, those freedoms and rights are sometimes abused. So care should be given to them.
Okay, let me thank all the speakers. Thank you very much for your contributions. This is a very big topic, so we couldn't cover all of it, but we tried to respond to most of the questions. A great thank you to the audience, and please visit us again in LSE and the Research Unit on Southeast Europe for more of these events and discussions. Thanks to all and goodbye.
Thank you.
Thank you.
Thank you.
Thank you.